While many South Africans are upset by the return of the alcohol ban, the health sector has responded positively. A report on the impact of alcohol on hospital admissions in the Western Cape showed that in the first week of lifting the alcohol ban, there was a 62% increase in daily trauma cases, with trauma deaths in emergency centres increasing by more than 300%. More importantly, these cases clogged up ICU and high care facilities for COVID-19 patients and risked peeling back the gains made during the hard lockdown when the healthcare system prepared for the peak in infections. So for more on this, let's rope in Dr. Saadiq Kariem, who's Chief Operating Officer in the Western Cape Health Department. The doc joins us now via Zoom from Cape Town. Doc, thanks very much for your time and welcome to the AM report. So the numbers speak for themselves, but how confident can we be that those figures are unequivocally, without any doubt, related to alcohol?
No, thank you. Yes, we've been doing a sentinel survey and we've been watching these figures over a long period of time. And we have found from previous studies that alcohol was related in more than 50% of our murder cases. We found alcohol present, and more than 60% of our road fatalities. So a lot of these figures are definitely related to alcohol. And the figures that you quoted was over a period of time. And we found that for the first month, for example, as you said, after the lockdown was lifted, a 62% increase in our trauma admissions. And many of those patients would require intensive care. Many of them would require theatre and therefore taking up bed space in the hospitals.
How different, for instance, is the figure you've just quoted from before we went into the lockdown? I mean, is this a particular spike that we're seeing, or perhaps, you know, the kind of difficulties you're faced with on any other day?
No, so I mean, we almost back to where we were before when we looked at our 2019 figures. That's generally would have been the kind of pressure that we would have seen. And lockdown definitely had a significant impact in reducing our trauma admissions by at least more than 50%. So the combination, I think I must stress, it's the combination of the lockdown, in other words, the curfew and people not moving around, plus the freely available alcohol, that was a significant combination, and that two together caused the spike in an increase in our cases.
It's interesting you say that. Can you take us through the nature of, I guess, the injuries, for lack of a better term, of people who are being admitted when, you know, I guess we can move around and can get access to alcohol? What is the nature of some of the wounds if you have to treat, if that's what you're focusing on?
Absolutely. So we're finding that over a period of time, we measure this, we measure in terms of fatalities. We found that most of these cases are gunshot victims, and quite a significant proportion of fatal stabbings as well. And when we have gunshots, the trend tends to have been not simply a single gunshot, but multiple gunshot wounds. So obviously this requires a significant amount of resources to be dedicated to treating those patients, and therefore intensive care. It's sometimes very difficult because obviously we have to make sure that we're able to provide for both the intensive care, critical care for these victims, as well as being able to have enough critical care beds for COVID patients. And at the moment, fortunately, we are able to do both. We are actually able to manage both the increased numbers of trauma cases, as well as having enough and sufficient beds for our COVID patients.
Which is, I guess, what we're hoping we'll be able to maintain in the distant future. But in a world where I don't foresee, you know, the alcohol ban remaining in place forever, how do you imagine we can at least work towards that, right? Work towards at least having some room and some capacity built in the long run to be able to do the work that you do?
Absolutely. And in fact, one of the key strategies is actually behavior change. And we have been working on this in the Western Cape for some time already. And there are a lot of societal factors that impact on behavior change. And we found, for example, when we did a project over a couple of facilities, where we have, at the moment, when people enter the facility, and we found that they've drunk or they've, you know, have had alcohol, at that moment we've been doing an educational intervention, and it has actually shown some promising results. So for us in the long term going forward, even post-COVID, behavior change is quite critical actually.
And hopefully that message resonates. We're going to have to leave it there. Thank you very much indeed for your time and getting us into the picture. Dr. Saadiq Kariem is Head of Operations in the Western Cape Health Department. Appreciate your time indeed.